Hey everybody, it's your friend Crystal here at the Fibromyalgia Pain Chronicles and Veteran Voices for Fibromyalgia. And today's video is more free-flowing to talk about a very heinous situation that happened with a disabled woman who is now dead. And I just feel that I need to speak on this topic for a variety of reasons, and you'll understand why, but also what happened to Lisa Edwards could happen with anyone with a disability, including invisible disabilities like the ones that I live with myself. And I have actually experienced not being taken seriously when I was having life-threatening situations and I went to the emergency room. So let me give you a little bit of background here. Lisa Edwards was flying from Rhode Island to Knoxville, Tennessee, and during the flight, she complained of having abdominal pain. This was on February 4th of 2023. Once the plane landed, the paramedics transported Lisa to the local hospital, Blount Memorial Hospital, and she was diagnosed with constipation and then discharged. However, Miss Edwards did not feel that her issue was constipation because what she was experiencing was not matching up with the symptoms of constipation. So she started advocating for herself to receive appropriate care and a full workup. During her time advocating for herself, the medical staff decided to call the police and report her for trespassing. So the police showed up. And at that time, it was 6:55 a.m. on February 5th, 2023. Miss Edwards was discharged from the medical center emergency room, and she had refused to leave because she felt that there was something else going on with her medically. As a result, the police came and they took her off premises, and they were arresting her for trespassing. En route to the police station, Miss Edwards was begging for her life, asking to be taken back to the emergency room, was saying that she was having difficult breathing, had asked for them to give her asthma inhaler. I had intended to splice in sections of the video from the police cam and how she was treated and mocked, even accused of faking by the police officers. Needless to say, this police cam video is a little bit more than an hour long, and I personally had a hard time watching it, and I have a pretty strong stomach, and the reason why I had a hard time watching it is because it could have so easily have been me in the back of that cruiser being charged with trespassing when I was advocating that I needed medical care. As a result of the hospital staff ignoring Lisa Edwards' pleas for medical support and treatment, and the police being called and the police taking her off the premises with the charges of trespassing, while en route, Lisa Edwards died. During the autopsy, it was discovered that she actually died of a stroke. The thing that really gets me is that this woman was begging and pleading for help at the hospital. And when they refused and discharged her and then called the police, she continued to beg for her life. She continued to advocate the need for her to have medical support, treatment, and intervention, that she knew something was wrong. And she was correct. She was experiencing a stroke, and she died in police custody. Now, at this point, there have been no charges brought to the medical facility, the medical staff, or the police officer. And the DA, the local district attorney's offices, determined that the police did not have any none of their actions, it was determined, resulted in her death. I beg to differ. When someone is begging for their life and asking for medical treatment, why is that a crime? And why do I take this situation to my heart? Well, for over 2 decades, I actually worked within healthcare systems, the mental health field, and intellectual disabilities field. And I've supported and advocated for many patients and clients to receive timely and appropriate treatment for their medical health and physical health and mental health conditions. I've walked the facility hallways in private health care, in state health-run mental health facilities, and federal healthcare systems, which is the VA. And I've walked these halls as both a patient advocate and also as a patient. I myself have been refused treatment or have experienced extreme delayed treatment when I've presented to the emergency room for what turns out to be life-threatening medical emergencies. The first time this happened was in the August of 2013, and at the time I was still married, and it was one of the few times that my ex-husband was actively involved in my medical needs, and he had taken me to the emergency room, and we sat there for over 3 hours. I was in agony. I couldn't walk. I couldn't articulate. I felt like I was going to vomit, and I had this extreme pain that was radiating up from the left side or right side of my gut all the way up to my shoulder on the right side of my body. And it was not anything I've ever experienced before and not related to my medical conditions. And I was not in the position, I was so poorly, I couldn't really articulate or advocate for myself. And my ex-husband did. And he got so pissed off that he literally picked me up and carried me out and took me to another emergency room where he explained what happened at the other facility. And they took me back right away. And initially, they thought it was like my gallbladder, but I said my gallbladder was taken out in 2010, so it's not that. So they were able to narrow down. I thought I might have been having appendicitis, which is life-threatening and would need surgery. But after doing CAT scans and ultrasounds, it was discovered that I had an ovarian cyst that had ruptured. And this can be life-threatening. It can also become septic. And I was sitting in an emergency room that failed to take me seriously because they could not see on the outside what was wrong with me. They ran no tests. They didn't even take me back to the emergency room department. I was in the waiting area the whole time. Fortunately, the other emergency room did their due diligence and treated me as if I was in acute medical crisis. And had they had not done that, I don't know if I would be here today. The second situation occurred on January 17th, 2023, just 2.5 months ago. And I presented to a local emergency room complaining of chest pain, nausea, really not able to articulate extremely well, feeling dizzy. I had already vomited and I was having pain in my chest, like right here. It was radiating all the way down my arm, and then my arm was intermittently going numb all the way down to my hands. And I was not taken back and did not start receiving any medical intervention, treatment, or medications for almost 3 hours. And the only reason why after almost 3 hours I was taken back is that they had done blood work. So a doctor in the emergency room department, while I sat in the emergency room waiting area, this doctor did not come out to speak to me, did not come out to assess me, did not come out to basically eyeball me, and just took the information that was that I provided during intake and when I first came in. And this doctor ordered blood tests, including checking if I was having a heart attack. I signed my consent for treatment forms at 10:59 a.m. This doctor, who did not come out to see me, put in the order for the lab work to be done at 11:13 a.m. My blood was not drawn until 12:25 p.m. And when the results came back, all of a sudden, I was being rushed back into the emergency room, and they had nowhere to put me. So they put me in the room that was designated for sexual assault survivors. And I felt horrible about that, because I'm sitting there thinking, okay, I'm having a medical emergency, but I'm in a room where if someone comes in who's been sexually assaulted, they have no safe place to put this person. So by the time a cardiologist was called down, it was 1:41 p.m. I showed up at the emergency room shortly before 11 a.m., signed my consent to treat forms at 10:59 a.m., and it took 2 hours and 42 minutes for me to receive any medical care for a life-threatening situation. And during that time, when I was finally taken back, I said to the nurse, I said, I can't help to think that my care was delayed because I'm diagnosed with fibromyalgia, among other medical conditions, but fibromyalgia is often dismissed by medical providers when you present to the ER, or what they do is whatever symptoms you are presenting with or complaining of, they default that back to that diagnosis of fibromyalgia. And they say, oh, you're having an exasperation of your fibromyalgia symptoms, and they might provide you some medication relief, and then they discharge you and tell you to follow up with your primary care doctor. I'm a very, very hardcore advocate for myself, and I know that the staff that day were extremely annoyed. I was the villain in their story that day. But at the end of the day, it turned out that I was right, and I was having a life-threatening medical emergency. I can't imagine being in a position where medical providers refuse to treat me or give me just a basic diagnosis of, let's say, constipation, like they did with Lisa Edwards, and then I would be forced to advocate for them to investigate further what is wrong with me medically. And instead of taking me seriously, they call the cops, and then the police charge me with trespassing when I'm just trying to exercise my right to be treated for a medical issue. And this is the thing that's crazy, is that these are not isolated incidences. I have seen both professionally and personally how patients are dismissed, especially when they have invisible medical conditions or invisible disabilities that are not presenting visually to medical providers. And instead of taking the time to investigate what was going on, they just default to some generic diagnosis of constipation, or they default back to one of your diagnoses saying it's that, instead of thoroughly investigating. And honestly, based on the police body cams and listening to Lisa Edwards beg for her life, where have we come in our society where we have to beg for medical care? And I know the reason why we have to beg to be treated in a timely manner and receive the medical services that we need. Because the United States is the only fully developed Western nation that has not designated healthcare as a basic human right. And some people might say that's not that big of a deal. But let me reframe this for you. By not designating healthcare and medical care as a basic human right, just as all the industrialized, fully developed countries have done, the United States is basically saying that I don't have a right to live, that I can be denied medical care even in a life-threatening situation, and that I don't have a right to live. That's what that means when they say that health, when they're not designating healthcare as a basic human right, they're saying you don't have a right to live, which is kind of ironic. In the Constitution, we have the right to liberty and freedom and property. But how can we live free if our medical care is not a protected human right? It's a bit of an oxymoron there. So I suggest Googling and researching to get the full story of what happened with Lisa Edwards. I will tell you, if you decide to watch the police cam footage, this is your trigger warning, because no normal human being could watch that and it not affect them. And if you're listening to this and you don't think it's that big of a deal, then you don't think I'm that big of a deal and we shouldn't be friends anymore. And if you're following me and you're listening to this and you don't think it's that big of a deal, then I'm failing as an advocate. Because if people don't understand why this is so upsetting and how it is just a personal reminder of how hard we have to fight to get medical care and how I easily could have been Lisa Edwards, then I must be failing if no one's getting it. And again, you can look up and research and watch the video. That is at your discretion, but I cannot see any human being with any inkling of a soul or compassion or empathy being able to watch that and not be traumatized, because it's really fucking traumatizing. And the thing of it is this isn't stuff that's happening recently, and I'm going to share another personal experience, and it goes back to 1997. February 12th of 1997, my mom took my brother to, ironically, the same emergency room department that I went to when I was having a heart attack. Woo! So my mom takes my brother to the same emergency room in 1997, February 1997, like February 12th. They did, some images and some blood work. And I know from what happened that my brother was discharged with a sinus infection. However, they had images, x-rays of his heart, and it showed, like when they did chest x-rays to see if he had pneumonia, it showed that he had an enlarged heart. Instead of investigating that further, they discharged him and sent him home with basic medications. 2 days later, my mom had to take my brother back to an emergency room, but she took my brother to a different facility. And long story short, my brother was diagnosed with congestive heart failure on February 14th of 1997. And it turns out my brother had also, cardiomyopathy, and he was in need of a heart transplant, which he never received. The reason why I'm sharing my personal stories and my brother's story, and it's not to detract from Lisa Edwards' death, murder, really, if you think about it. The reason why I share these experiences is that this is not isolated occurrences. It's not something that's recently new that we're seeing. We just are only hearing about it because of the boom of social media. Back in 1997, we didn't have social media. So I'm bringing up these instances, and I could tell you so many more with clients that I've worked with, including 2 that died, and it was preventable deaths. And they were similar situations where they were in the emergency room, and I just feel like these are senseless acts of medical violence against patients when they're not taken seriously, and then the outcome is extreme physical harm, an injury, or death. And this is something that's happening in private healthcare systems. This is happening in state-funded driven hospital systems like mental health facilities. And this is happening in federally funded healthcare facilities like the VA in the United States. My question is, how many more Lisa Edwards need to die before we decide that healthcare and medical support is a basic necessity of life? I mean, if we don't designate it as a basic human right, then we might as well just dismantle the entire medical system. What's the point? What is the point? So I normally don't do heavy videos like this, and it's really hard for me not to like go off on a raging tangent because of how angry I am about this, but also how personally close it is to me because of how many clients and people that I care about, including my brother, could have died in those initial incidences because medical providers didn't take the patients seriously. And I've experienced it myself. And I'll be honest, a couple of times I'm lucky to be alive. A couple situations. I really am. But I had to fight. And I shouldn't have to fight. No patient, especially when they're in a life and death emergency, medical emergency, we should not be put in a position where we have to fight so hard to be heard and get the medical care we need. And no one should be arrested for trespassing at any medical facility. That's what they're there for. And just because one or two or an entire department doesn't believe that someone is having a medical emergency or a life-threatening condition, it doesn't mean that they're correct. And this is where we're failing. There's just so many variables as to why our healthcare system is broken. We are the wealthiest nation. Yet, we have people that are starving. We have individuals such as myself who are disabled, who barely make ends meet. And then we have to sit there and negotiate with ourselves. Like, I probably should be seen by a specialist sooner than later, but because of the cost of healthcare, even when you have insurance, it's astronomical. And I don't know, about 6 years ago, I had about 40 grand in medical debt. It's down to about 20 grand because I can only pay a little bit at a time. Because otherwise, if I try to pay more, I'd be destitute. And that's crazy to me that I have to, at times, choose between medical care and my ability to pay my bills, and have, as a disabled veteran, at one point having, it was like $42,000 and some extra amount of dollars that I've slowly, actually it's been longer, that debt is probably about closer to 7.5 years old, that I've been slowly paying down, and it's taken me almost 7 years to pay it almost halfway down. And no one should have to choose whether they pay for food or pay for prescriptions or pay for medical care copays or pay their utilities, or choose between getting clothing for their children or going to a specialist more often. No one should have to choose those things, but here we are, constantly put in a position where we have to choose things that sometimes are not good for us, for our health, not good for us medically, because we have other substantial needs that need to be met. It's time that we wake up and we mobilize and come together. Individuals with disabilities, those without disabilities, caregivers, friends, followers, and say enough is enough. And that healthcare needs to be legally deemed as a basic human right that no one should have to fight for, much less be arrested for and potentially die as a result, like Lisa Edwards did. So, sorry I did kind of go on a rant and a bit of a downer today, which I normally am not, but hopefully you all can see and just hear me but more importantly, become a voice for Lisa Edwards and everyone else like Lisa Edwards, including me. So until next time, make your self-care your number one priority. Love yourselves, love each other, and don't stop fighting for your rights, for your overall health, life, and safety.